All right, we are going to go ahead and get started. Thank you so much for joining us, everyone. If we have not met, my name is Julia Brennemer. I am the SNAP-Ed Community Partnerships Coordinator here at the Indiana Department of Health, and I sit in the Division of Nutrition and Physical Activity. And today we are going to be talking about the SNAP-Ed grant. So just as a brief overview of what we're going to be discussing today, we thought it would be difficult to talk about the SNAP-Ed grant without talking a little bit about what SNAP-Ed is here in Indiana. So we'll explain a little bit more about the SNAP-Ed program, and we'll go into the purpose of the SNAP-Ed grant. We're then going to outline eligibility, unallowable costs, and a few project examples for you all. And then we're going to open up the floor and you can ask any questions. And if any questions come up, feel free to put them in the chat too, and I can stop and answer as we go. So SNAP-Ed in Indiana. SNAP-Ed stands for the Supplemental Nutrition Assistance Program Education. So it serves as the nutrition education and obesity prevention arm of the SNAP program. So you might be familiar with the SNAP program that helps individuals afford more nutritious foods and just provide foods for their family. This is the educational piece of it. So this is USDA funding, and funding flows into our Family and Social Services Administration, and then here to us at the Indiana Department of Health. We are the state oversight agency, and the largest implementing agency in Indiana is Purdue University Extension Nutrition Education Program. So thank you to all of our NEP folks who are hopping on. I know there are a lot of community wellness coordinators on the call. So just to explain a little bit more about what our Purdue Extension folks do, it's a two-pronged approach here in Indiana with SNAP-Ed. We have our community wellness coordinators who really collaborate with community partners and work towards community change with policy systems and environmental change. And throughout the RFP, you'll hear the words a lot: PSC, change, policy systems, and environmental change. What we mean by that is the policy part. You have your laws, your ordinances, your rules and regulations. You have your systems where you're working with individuals from different sectors. You could have schools working with nonprofit organizations, working with local governments, really to understand how processes can work together in order to support the goal of SNAP-Ed, or just making sure there are nutritious foods and physical activity environments in the community. And then you have that environmental piece where it's physically looking at the environment to make it safe in order to support our goals here. So the other part of that is our wonderful nutrition education program advisors, our NEPAs. They do direct education and go into a lot of different organizations. It could be YMCAs, it could be recovery centers, whatever you can think of, to really just provide education for people on how you can cook certain foods and how you can stay active. But with both of these positions and us here at the state and Purdue Extension, we all have the goal of supporting SNAP eligible families and communities so that they have that access to nutritious foods and safe physical activity environments wherever they are in their community. And below you can see some cool examples with what the community wellness coordinators do. We have the Oasis over in Fayette County is one of our community wellness coordinators initiatives. Becky Marvel, if you know her, this is a great community garden effort that helps to provide food for the community and also educational opportunities. And then you have an example of how we get some kids moving during the school year with our SNAP-Ed nutrition education program advisors. So with all of that being said, the purpose of the SNAP-Ed grant is really just to support the efforts that I have described earlier in communities. It's to ensure that SNAP-eligible populations have access to nutritious foods and safe physical activity environments, and they have the equal opportunity to make decisions to address health. And within this grant program, we are wanting communities to be innovative in the way that we address SNAP-Ed and the education piece. We're really hoping that communities can come together and decide how different sectors can be involved while also implementing community members and their voices. We think it's really important that community is addressed and involved when there are going to be programs that are going to be coming out to help in terms of health and nutrition and physical activity access. So with all of that being said, those are the big goals of the SNAP-Ed grant. We're going to go into some of these grant considerations. With this being a USDA grant program, I'm sure you can imagine if you've ever written for any sort of federal grant, there are a lot of different considerations and eligibility pieces that you have to consider. And because we are supporting SNAP eligible populations, we want to remain in line with that audience, with that population that we're wanting to serve through this grant program. So there are 3 different qualifying criteria to ensure that. And the first is communities have at least 50% or more of residents living under 130% of the federal poverty line. Now, within the RFP, there are links for all of this where you can go and check it. Within this specific qualifying criteria, number 1, you can go to the Feeding America map and you can scroll over your county and it will tell you that percentage, 130%, and that number would need to be over 50%. Also, schools, if you're wanting to work in schools, the schools would need to serve a student population with 50% or more qualification for free and reduced lunch. There is a link to the Department of Education's data on this, and you can scroll down to the specific school and you can look over what their percentage is. And then we will look at social vulnerability index scores with the CDC. That is a number that the CDC, a map and idea that the CDC has come together, and it considers a lot of different factors: household income, demographic information, environment. So that's a comprehensive way for us to ensure that the SNAP eligible population is being supported in these efforts as well. If you do not meet all of this criteria, that's all right. We would just need a justification. We would need, just tell your story here, why these funds would be in line with what we're trying to do with SNAP-Ed and serving SNAP eligible audiences and those who might not get support otherwise. Some unallowable costs. If you go through the RFP, there's a long list. We didn't even put all of them within the RFP, but in general, these costs they can't supplant other USDA funding opportunities. So if there are other funding opportunities that can address the what you're trying to address in the community, they can't overlap. So we just have to be careful about that. There's also certain things that can be funded, like medical nutrition therapy, the diabetes prevention program, and acute disease treatment. This is really prevention work. And like I said, policy systems and environmental change support work. Some main unallowable costs that are helpful to know are large equipment costs over $5,000 cannot be within the budget. Incentives over $5 cannot be paid for with SNAP-Ed funds. That being said, if there are other funding opportunities in which you could support incentives, SNAP-Ed funds might be able to come in and supplement staffing costs and other things that are allowable within SNAP-Ed. So if you all can move funding around in a way that can work, the SNAP-Ed funds can fund pieces of that. Capital improvements, so large changes to infrastructure. This isn't a grant that's going to support sidewalks or large pieces of equipment, as I said. Costs associated with refrigeration units, grocery store shelving, and really anything that goes above and beyond the scope of SNAP-Ed grant, the SNAP-Ed grant as I've described it. And if it serves more of the general population, there needs to be a case that this funding is really focused on those eligible for SNAP. And direct food costs are also an unallowable cost with these grant funds. The only food cost that would be allowable would be if you're using food costs for food demonstration purposes. So you're doing taste testing or some sort of nutrition education class and you're providing small samples. That would be the only direct food cost allowable. DPP is the diabetes prevention program. Some project examples. We have put them into these 5 categories. So you have the capacity building initiatives. A few examples of that might be something related to coalition building or strategic planning related to this work, or volunteer engagement practices. Built environment initiatives would be walking maps, signage, any sort of youth development project that would be evidence-based. You have the local food infrastructure, so you could look at farm to school initiatives, you could do food councils, you could do farmers market initiatives, anything related to that. With food access, you can do food pantry initiatives, any sort of translational services with food access in your communities, nutrition incentive programming, healthy corner store initiatives are examples there. And then breastfeeding, you can support lactation policies within different workplaces. You can do peer support groups and lactation stations, and you can partner with the milk bank to put together some milk drives that project examples that really support this idea of multi-sector engagement and community involvement from last year that we funded. One would be the Northwest Indiana Food Council. They funded a local food access coordinator, and this involved, they hired a coordinator to do technical assistance with a cohort of farmers and markets wanting to become authorized in SNAP and WIC. And they were providing general support and coordinating outreach. So this would be multi-sector. You're helping different markets come together. You're really trying to promote food access within your community through making sure that SNAP and WIC benefits can be accepted. So that was a great example from last year of what we funded. And then we funded Eskenazi Health last year as well with an expansion of their mobile market, their Fresh to You Market on Wheels. And funding for that, they did a hybrid funding. So our funding went to paying for a community health worker and providing supplies for cooking demonstrations. So that would also be a great example of, we wouldn't be able to provide the overall direct food costs in this instance, but we can come in and provide funding for staff costs, or in this case, cooking demonstrations or smaller cooking equipment that would help with these demonstrations. We can't do larger equipment, $5,000 or over, but we can do smaller equipment that would help in this case with cooking demonstrations. So in terms of the timeline of the grant, this is due on February 10th at 5 o'clock to me. At the end of the presentation, there'll be a subject line that helps to organize so that nothing gets lost. And then by February 24th, applicants will be contacted to schedule a brief 20-minute interview. And those interviews will be the week of March 6th. And these interviews are just going to be 20 minutes long. It's going to be 10 minutes of some sort of presentation, and then, or any way that you all want to tell your story, you can be very unique and creative in that aspect. And then it'll give us 10 minutes for our review team to ask questions. And our review team, we have some internal folks here, and then some folks who work in this space who wouldn't be applying for the grant funding. And then we have our funding announcement on March 22nd, and the project start date is May 29th to give our contract process the time that it needs in order to get you the funds. We also work off of a reimbursement model, which I think I'll mention in a few slides, where you would invoice us and then would be reimbursed for your funds. Yeah. So there is a $50,000 cap per application. Awardee, if you were awarded last year, or the organization you're working with was awarded last year, they can apply again. That doesn't guarantee that we would be awarding, but we're not restricting anyone who were awarded last year. In total, our funding is $250,000. And if you are awarded, grantees do submit a bi-monthly report and a final report. We would create and send you the bi-monthly reports. We have calendar holds and schedules to get those to us. And then your final report would be before the funding cycle ends in 2024, September 30th, 2024. As I mentioned, the application process will just have this letter of intent that's with the request for proposal that was sent out, and then the 20-minute informational interview. And as I said before, the IDOH SNAP Ed Grant Application 2023 email signature or subject line is going to be really helpful for me as I organize the information, just to ensure nothing gets lost. Now that was a lot of information. Let's see, there is one question in the chat. Can this grant be used purely for staff contractor costs, or is there a percentage limit for that? No, you can use it all for staff costs if that's what you would like to use the funds for. Thanks, Katie. Any other questions generally about the SNAP Ed grant, about SNAP Ed? Becca, would pots, pans, crock pots, cooking utensils count against the no nutrition education reinforcement items over $5? Yes, you cannot give unless you can find it for under $5 in terms of an incentive, it cannot be given. If you are using those items for any sort of cooking demonstration, that would be okay for those items. But yeah, that is over the $5 the $5 incentive. But as I said, if you can move some funding around to incentivize it a way that's larger than $5, we can get other costs there for you. Can the value chain professional work be funded? Yes. That if you are working within the population that we have described here, like our example with the Northwest Indiana Food Council, they essentially hired someone in a similar type of way to build those relationships and get people connected with that. So that is an allowable cost. Direct purchase of food is not allowed, but vouchers for community supported agriculture or SNAP matching allowed. Could a farmer be paid for their time and donate the food? That's a good question. The vouchers, SNAP matching allowed. Megan, do you have, I know you funded specifically more information about this.
My gut would say that as long as you're providing invoice documentation that shows that the farmer's being paid for their time and not for food, then technically speaking, yes. But we would really have to see that in writing and go back through our multiple page document to give you a final answer. So Julie and I can definitely check into that for you. But yeah, food is not allowed. So even a voucher in between the food and a participant, I also believe is not allowable via these funds. That is something that has been allowable via funds out of our division that have a completely different funding source and a much more generous allowable cost list. So I'm going to say yes to the time, probably, and we will continue to check into the voucher question. That's a good question. That's a lot of gray area in the guidance that we will have to navigate for that one.
So I have a couple of suggestions.
Yeah, and if just as to explain the process further, we go to the USDA and we present these budgets and give explanations. So it's really just going to be up to us and having the conversation, and they will say yes or no with that. So that's definitely something we'll look into. Are there any other questions about allowable costs? A minimum amount. There is not a minimum amount, just the cap of $50,000. I think it would depend on what they're invoicing you for. It would just, or were you talking about like food in that instance, or for the question if we were working with the food bank and they invoice us, would that be an allowable cost?
Item 1 apply to that.
Yes, that is an unallowable cost. Just it's anything outside of the nutrition education piece with taste testing that's food costs, and it's considered an allowable cost with SNAP Ed funds.
So I would connect
Julia, there's a question about the SVI index.
attach the same PO, attach the same invoice. She can send one,
Whatever is in that map, I know it's not super up to date. They changed the formatting of it, but didn't update as much of the data. So whatever is in that map is the most up to date. That's what we're looking at. Purchasing for seeds for a garden, is that allowed? Yes, that is an allowable cost. The project would need to be completed by September 30th, 2024. That is our SNAP Ed federal funding cycle.
Or at least the part of the project that you're using our funding for. So obviously, if you are stitching together funding sources and this is going to be a continual thing, that's fine. But that is like the period that you'll have to report with us through.
Did you say 2023 or 2024? I thought I heard 2024.
2024. Yep.
Okay.
So it would
Thank you.
start May 29th, 2023, and you would have over a year to get that completed, like Megan said, just invoicing us for the funds that you are using for this grant.
Thank you.
Yep. So for the county information, there are specifically with FSBI. So with the two qualifying criteria, the first couple, the 130% below federal property line, that can just be county level. Same thing with if you're working with a school. Within the SVI 4, it's very small. It's a little toggle that says county versus census tract, and you can click that and it gives more of a breakdown of census tracts. So it can be a little bit more specific to the county area that you're serving, because that has been the case where the county at large doesn't look like it would qualify, but if you dig a little deeper into where you are going to be at, it does. So that would be a helpful thing to look at. If you have any further questions about where to find that on the map, let us know, but it's at the top and it's just a little toggle that just says census tract and you can click that.
I would also add, if you have any additional information outside of what we've requested in your application that would make the case, feel free to include that. For example, some healthcare partners might have very specific data on the patients that they serve in their healthcare setting related to poverty level or food insecurity status or whatever, based on screenings or other documents that are collected. So if you have data outside of the data sources that we've asked for or data sources we've given you, we welcome your explanation. And this is always something that we can verbally talk about in an interview too, if there's any questions or confusion. I think the discrepancy here is between the response that Julia emailed you and the response that I verbally gave, which I may be incorrect here, but if so, I think some of the questions that were addressed in here, like about the farmer time, that's very different because it's being billed and presented in a very different manner. The voucher one, like I said earlier, I don't believe would be allowable, but it is something we can continue to look into. And if that answer comes back as a yes, we can obviously update you via email that Julia has a thread with you. The direct purchase of any form of food other than like for that cooking demonstration or whatever is not allowable. We have never had the question of vouchers asked in more than once and in very different ways. So with that piece of information, we will continue to do our due diligence.
Yes, stipends is a very interesting word. We had this issue last year who were wanting to utilize student services and compensate them. If it's written as just staff time, at like, yes, a dollar per hour, that's better and can get through. A scholarship or a stipend written as that is not, the USDA has come back and said no. So yes, just do staff time, dollar per hour, and that would be good.
Yeah, you can also call them interns and just give them $1 per hour. That's how we adjusted some of our grantees last year to get them through. It's just adjusted the wording. So if we need to do it again, we can help you do that too. But yeah, it's best to just present them as staff members, even if they are part-time temporary staff wages.
Oh, good catch. Good catch.
Great. Any other questions? If you have anything that comes up, let us know. We will dig further into that voucher situation and that gray area, and deliver it in the best way that we understand. Right. Well, I hope you all have a great rest of your day, and we will get all of this posted on our websites and send it out to anyone who might have missed it. Have a great day. Thanks all.